In this video, we have your Acetenobacter, and in this image, you can see it. So this is an example of your gram stain. For the Acetenobacter genera, you have a result of negative for your oxidase test and a positive result for your catalase test. They are non-motile. They have a coccobacilli appearance. They are plump. They are paired rods in direct smear. So this also grows as purplish colonies on your mat and gummy colonies on your back. So this genera has 25 species based on the DNA hybridization. In this genera, you have your two common variants, which is your Acetenobacter baumannii. Take note of the spelling. It's double N and double I. This bacteria is a glucose oxidizer and is non-hemolytic. So this is the second most commonly isolated non-fermentative bacilli from humans. Next, we have your Acetenobacter uofi. This is a glucose negative and a non-hemolytic strain. Generally, your Acetenobacter species is ubiquitous in the environment, seen in soil, water, milk, hospital, ventilators, and in the human skin. So they are opportunistic and they account for 1 to 3% of nosocomial infections. Again, what are nosocomial infections? These are infections that are caused because of a compromised host. Second, after Pseudomonas, they are commonly isolated in the laboratory. So you can see them in pneumonia, in your endocarditis, in meningitis, cellulitis, septicemia, and in UTI. Next up, we have your Stenotrophomonas. So this is an example of your colony at a blood agar plate. There is one species that you have to remember for this genera, your Stenotrophomonas maltophilia. It has a biochemical profile similar with your Burkholderia cepacia. It is catalase positive and oxidase negative. It is non-motile. It is motile because of its polar flagella. So it oxidizes maltose faster than glucose. It also causes nosocomial infections on immunocompromised patients. For the lab diagnosis, in your media, it produces brown pigment on heart infusion agar with tyrosine. And in your BAP, it appears to be lavender green to light purple pigment with ammonia smell. The next genera that we have is your alkali genes. In this genera, they are gram-negative bacilli. They are motile because of your peritrichous flagella. You have your oxidase, catalase, and 6.5% sodium chloride test to be positive. And in your media, they appear to be feathery edge and non-pigmented colonies on your back. So some also produces alpha hemolysis. One thing that you have to remember for this species is that they produce a fruity odor, specifically apples or strawberries. They are isolated from your urine, feces, sputum, and wounds of hospital patients. Next up, we have your Moraxella. Your Moraxella species is oxidase positive. They are non-motile. They gram-negative diplococci or diplobacilli. On your back, they appear to be small, pinpoint, and non-pigmented colonies. And in your back, they poorly grow or they don't grow at all. So they are biologically inactive. There are three Moraxella species that you have to remember. This is your M. lacunata. This produces this causes angular conjunctivitis or blephanoconjunctivitis. You also have your Moraxella non-liquefaciens. This causes infections of the eye, your RT and genital tract. And lastly, you have your Moraxella oslovensis, which is the normal flora of your gastric tract. For the lab diagnosis, you have your CTA or your cysteine trypticase agar. Take note that Moraxella cataralis does not ferment any major sugar. So the penicillin sensitivity test is resistant, and growth in BAP would show fits in the agar. Lastly, we have your Flavobacterium and your Chromobacterium. Flavobacterium species fail to grow in your McConkey agar. They are oxidase positive and they are non-motile. So they are found in soil, water, and other moist areas and plants. They also produce yellow intracellular pigment. So they show a lavender green colony on your sheep blood agar plate due to the gelatinase. They also produce a fruity odor. Now we have your Chromobacterium violosum. So this grows in your McConkey agar at 42 degrees. They are oxidase positive and they are motile with polar flagella. They may appear as a curved bacilli. So they also produce a violacine pigment and they are fermentative gram-negative bacillus. So they ferment glucose and variably sucrose. These are opportunistic pathogen that affects the immunocompromised patients with PMN deficits. Here are the references used for this lecture. If you have any questions or clarification, you can base your questions here or you can directly ask me through Canvas or through email.